Well, welcome here to an Ignite Press book launch livecast. Today, I have Dr. Selma Rashid here, and she's going to be talking about her book. And this is great because I think it's very timely. I know a lot of people whose lives are going to be impacted by Dr. Rashid's book. Now, before I get to Dr. Rashid, if you have a book and you're interested in speaking with us about how to get your book and your message out to the world, you can just reach out to us at ignitepress.us. That's ignitepress.us. And we publish books around the world. And we'd be excited to talk to you about your message. But today we have Dr. Selma Rashid and her book, The Truth Behind Hormone Replacement Therapy, What You Need to Know to Remain Youthful and Healthy. Now, Dr. Rashid was born in England and trained in Chicago, Illinois. She's board certified in internal medicine, and she is an expert at this topic with over 2 decades of experience in bioidentical hormone replacement therapy. Quite frankly, she is the one to talk about this subject. So let's bring her on. Dr. Rashid, how are you?
Wonderful. Thank you so much, Everett.
Congratulations on this, your book launch day. We're excited as we track results and watch the incoming sales numbers. It is super, super fun to watch. I thought it would be best to start us off with just asking you to tell us a bit about yourself. How did you get to this place where you are an expert in hormone replacement therapy?
Actually, it started from my own personal interest. A couple of decades ago, I was at the stage of my life. I'm thinking, about 10 years from now, I'm going to be approaching menopause. I certainly don't want to go through what other women go through, and I don't want to age like the normal aging process. So determines how we age: senile dementia, osteoporosis, all these debilitating illnesses and diseases and processes that occur with aging. I wanted to find out how to avoid that, how we can deal with that, and that's when I really started looking into this topic more deeply. And hormone replacement therapy, honestly, is the number one solution we have to prevent the chronic diseases of aging and prevent also the normal degenerative aging process. That's what got me interested. And then, of course, it's just been an ongoing effort since then.
Well, and while we're doing this, I want to let people know that they can actually type any questions or comments into the chat log, and we'd be happy to bring them to you and share them so that we can get that message out. So, Dr. Rashid, first, I think it'd be great for a lot of us to just get a basic understanding about hormones and their role in our aging process. Can you educate us about that?
Yes, well, as human beings, we have a very predictable life occurrences in life. We're young, we develop, we're fertile for about 20, 30 years. And then for women, it's menopause that's the turning point. And that's an average age of 51. And after that, at that point, your body stops making estradiol and progesterone. All the other hormones are basically there, but estradiol and progesterone start being produced by the ovaries. And that actually initiates a very rapid declining in aging, in our health. We start getting osteoporosis at a faster rate, senile dementia starts happening. Our muscles, our tendons, our ligaments, our immune system, everything starts degenerating at a faster rate. Now, this started happening to us in our 40s, but we still had some level of estrogen and progesterone, so we didn't feel it as much. But after menopause, all the degenerative processes accelerate. And again, in men, it happens when they lose testosterone, but men don't go through anything that's the same as menopause. Their degenerative changes is a lot more constant. And so they don't have menopause type symptoms, but they age just the way we do. So, again, life is it's great until until you have these hormones, but once they start getting out of your system, we just continuously degenerate.
Okay. And you said something really key that really, this is for men and women. This isn't just for women as they approach menopause and that type of thing. So tell us what things can be done? Like what things can be done in order to avoid going through these transitions?
Well, everybody who is at menopause, is a candidate for hormone replacement therapy. Now, for women, it's much easier because they have symptoms, when they have menopause symptoms. And so at that point in life, and honestly, it's better if you, pay attention to your symptoms a few years before that, um, measure your hormones. And then once you know that you're at that point, it is really important to start replacing your body with estradiol and progesterone in normal human ranges. And honestly, that is the most powerful intervention that we can do to prevent the diseases of aging and also to remain healthy, young, functional. And obviously, you're going to get rid of all the nasty symptoms of menopause. But the most important thing is that not all women have menopause symptoms. Menopause symptoms, such as hot flashes, night sweats, these don't happen to everybody. And sometimes people just get them briefly, but 100% of us age after this time in our lives. Um, with men, it's harder to determine when they've reached a critically low level of testosterone. And the only way they can know where they're at is just having blood tests.
Okay. And in fact, Chris had just asked, how do you measure hormones? And is that done through blood testing? Does it have to be done once? Does it have to be done over a protracted period of time? How's that done?
Right. So for men, it's much easier. You just have critical morning levels of free and total testosterone measured, and ideally before 8 or 9 o'clock in the morning. That's when levels are highest. You always want to measure hormone levels at their peak. For women, if they have a period, if they're still having a cycle, then you want to have blood levels done according to the two peak hormone production phases of your cycle. Typically, it's day 10 and 21, or day 12 or 20, depending on your cycle. I explain that more in my book. But blood test is honestly the only reliable method we have. Um, that's if you have a cycle. If you don't have a cycle, then you're low. Then you can measure other blood levels, FSH, LH. These, your doctor should know this. For menopausal women, it's easy. You just measure FSH, LH, and you know that they're not producing anything if they used to have a period and now they don't. And of course, there are women who still are critically low, still have a period. Then you have to have them done on specific days. Otherwise, the test is not useful.
Okay. And do most general practitioners know how to do these tests appropriately?
And that's a tragedy. No, they don't. I have many patients who come to me and tell me that, yes, I got my levels done and they were normal. And they have a period. And I said, which day did you go? And they don't know, and neither did the practitioner. And there were random labs. And the range is so broad that it's just really a useless test. So no, unfortunately, this is something that we're not taught. It's the biggest tragedy of our era, that we have so much knowledge, but it's not taught to practitioners. And women just continue to suffer unnecessarily.
Well, it's interesting because I remember having my testosterone levels done with my general practitioner, and I didn't receive any instruction to go do it first thing in the morning.
It's
Uh,
critical because that's when it rises. After that, it goes down, and it's normal to do that.
yeah. So when you're treating somebody, let's say you determine that their levels are not optimum, what does treatment look like? Like what do you do to try to improve this?
For women, we give them estradiol, and I'll just clarify this. Estrogen is a it's a it encompasses every type of estrogen: horse urine estrogen, plant-based estrogens. It's like alcohol. The term alcohol. There are many. It's a category of hormones. Alcohol is not a hormone, but a category of molecule. Estradiol is a specific estrogen that our ovaries make, and that's the one that we should be replaced with. So I would, if somebody's not making estrogen, estradiol, or progesterone, and I would know that through blood test or the fact that they are menopausal, they're not having a cycle, put a few things together, then we would start them on topical estradiol and progesterone in a cyclical way, the way that our ovaries make it. And that's the way our body recognizes it and knows what to do with these hormones. And then, of course, we measure. Then we definitely measure periodically what's in their blood, and we correlate that with the symptoms and a few other things, and then we get them balanced. It takes a few months to balance somebody because I don't know how one person versus another is going to absorb or how much they need. So that's about as hard as it gets. And after that, you know what your body needs and you take it for life.
Okay. So, boy, there are a ton of questions coming in here. And so let me bring some of them up on the screen, if you don't mind, and we'll kind of address some of them. So Darlene asked if borderline osteoporosis can be reversed through this treatment.
I've seen it happen. One of my patients back in, it was about 2005, beautiful woman, tall, slim. She was about 50, and I said to her that, would you consider hormone replacement? Because she was concerned about her well-being, aging, etc. And she said, the only reason that I would even consider it is that I've got 12 areas of osteoporosis, and I have to drink this medication. It's a bisphosphonate. They're pretty nasty. And she goes, it's so caustic, it's toxic, and that's the only reason I would consider it. She started hormones. Within 1 year, she had only one area of osteopenia. Osteopenia is the beginning of osteoporosis. And so with her, it did a lot. But I will caution that, yes, definitely, estrogen has been shown to prevent osteoporosis, but you have to be in what we call physiological ranges, normal human ranges. Tiny little bits is not really going to do it because osteoporosis starts in our 40s. And then at that point, we still have some estrogen, but it's not enough. And the genetic factors that determine also how much our body needs. So no, definitely it will. And I will also say that back in 1930, Fuller Albright, who's a renowned um, American endocrinologist, he at that time said that estradiol prevents osteoporosis. Osteoporosis happens because women lose their estrogen. We knew it back then, but we didn't do anything about it.
So let me do this. I would be remiss not to remind people that The Truth Behind Hormone Replacement Therapy is currently available on Amazon, or you can pick up the Kindle version, which is on a launch special right now for 99 cents. The paperback is also available. And I would encourage you to pick up this copy, this book, maybe pick up a couple copies of this book, because there are people in your life that need this information. In fact, after our launch today, I'm taking our copy here home to my wife because I know that she's going to find this to be absolutely fascinating. So some more questions here. Deb Marie asks, when it comes to measuring, what if your cycle's not normal all the time, or what if your cycle's really stopped?
Well, if your cycle is not normal all the time, we just catch you on a specific cycle. For instance, this happens a lot to me, and women have irregular cycles, or they miss cycles, especially in the few years prior to menopause. And I'll tell them that if you've not had a cycle for 1 year, you are by definition in menopause. But if you have a cycle every other month, you can wait till your next period starts. That is your day one. And from there, we track you on certain 2 days of the month, and we measure your hormone levels. But honestly, if that's what your cycle is doing and you are at that age, you're definitely low. You're certainly too low to be healthy as far as your muscles, your bones, your brain, etc.
Okay. A couple other questions. So Darlene asked this one. She was probably inspired by looking at me. She said, what causes baldness in men? And is that hormonal?
That's a billion-dollar question. Well, some men get bald in their late 20s, and it's a genetic tendency to convert testosterone to DHT. And then, of course, you have to have other things that receptors, on your body. There's too many factors. It's $1 billion industry. I wish I had that answer. I wish I knew more about it. But one thing I will tell you though, very important, slightly off, not exactly answering Darlene's question, but women, many women, not all women, many women around about menopause start having this male pattern baldness, which on the center of their skull, they start getting widening of the parting and losing hair there, although the rest of the hair might be thick. Those women typically have that genetic dysfunctional gene that causes baldness in the males in the family. And for women, there are, hormones, yes, it'll help, but there are treatments for that. But honestly, baldness is tough. I wouldn't know how to answer that, in a fair way for Darlene. Um, I don't know
That's
why
okay.
it
Lots of
happens. Yeah,
lots of factors, like you
a
said,
lot of factors. Yeah,
and that's genetics and hormones and
yeah.
maybe what shampoo people use. I don't know, but
No,
yeah,
actually, it's again, it's genetics, and the two main
genetics.
factors, and like I said, it's $1 billion industry. Even trying
Yeah,
to figure it out.
no coincidence that my hair looks just like my dad's did when he was this age. So yeah,
Exactly.
that's
Yeah.
not a coincidence. So Mashana had a great question. So let me share hers. So women who've had a hysterectomy but retain their ovaries, do they have a need for hormone replacement, or do they need more?
Well, it depends when they had a hysterectomy. If they had the hysterectomy in the late 40s or the 40s, it does disrupt ovarian production. And also, I'll tell you, the question I ask many women who have had a hysterectomy is, why did you have it? Nobody has a hysterectomy for the heck of it. It's usually because they've had ovarian dysfunction, they've probably had fibroids, excessive bleeding, the hormones are not produced in balance. So they do make some hormones. It's very hard to measure them because they don't have a period, and you don't know which days rather to do the test. But very typically, women who have had a hysterectomy will be low on hormones, especially as they approach the late 40s. And at that time, we can always correlate your symptoms and see if hormone replacement, alleviates your symptoms. And usually, most likely, these women are perimenopausal and good candidates for hormone replacement therapy.
Yeah. And Dorothy put this: are there different ways of treating hormone imbalance, doctor to doctor, and is your method more beneficial? And if so, why?
Well, the thing is that, my I don't have what I try to do is stay with what's most natural. Okay, firstly, what are we losing? We're not losing testosterone, we're losing estradiol and progesterone. Testosterone is mainly made in women by the adrenal glands, although in young women, some of it is made in the ovaries, but mostly it's the adrenal hormones. So first thing you want to do, if you are going through menopause, then what you're losing is estradiol and progesterone. So we start with that. We make sure they're bioidentical. I do explain that in detail in my book what it means. It's just the molecule is exactly what our body makes, and then you want to be in normal human ranges. And so if you meet those criteria, that yes, you're using the correct hormones, you're using the two hormones that are ovaries used to make and now they're not, you replace them in what we call physiological doses, and that's normal human ranges, then that's all we really need to know. And it doesn't matter which doctor is doing that. And very importantly, you must always have your labs done so that you know that you are in the right ranges, you are absorbing it correctly, you're not going over or under.
Mhm. Are there special labs for that, or special tests that are done beyond the normal screening that I can, that is commonly
It's
done?
very it's just blood test. And again, I used to also, I rather fell in the trap of doing saliva test. Saliva is good for certain things, such as cortisol, but when it comes to estradiol and progesterone, it can really be misleading, and I've suffered from that. So there isn't an excellent test, but the best test we have is the blood test. But you have to do it very specifically. You have to, it's about timing. You don't want to put hormones on your arms, for instance, and go and get blood done from that, you're going to pick up the hormone, and it's going to give you false results. So I have specific instructions for my patients when they do go for blood tests, when they should go, how they should do it. And then if they follow that, then that is the most accurate test.
And I'll remind everybody that you can get all this information and much, much more in Dr. Rashid's book, The Truth Behind Hormone Replacement Therapy. She's done an amazing job in compiling the necessary information and action steps here in the book. And she's done it in such a way where it's understandable. It's, it's not a bunch of doctorese that we can't, comprehend or follow, but instead it's said in a way that we really can comprehend it. And more importantly, take action on it. So now, Dr. Rashid, here comes another great question. So let's do this. You mentioned topicals earlier, and but are there other methods for hormone replacement therapy? And you also mentioned bioidentical hormone. And so does that vary as far as its administration?
Okay, so I'll just start with the bioidentical question. Bioidentical is an arbitrary term. It means that the hormone is molecularly identical to what your body makes. This is a very important concept, and I dedicate a chapter in my book to explaining why that's important and what it means. So bioidentical really is the only type of hormone you should be using. I know that in England, they're starting to use this term body identical. It's just something that the pharmaceutical companies are coming out with. Confuses people more, but really the molecule it has to be exactly what our body makes, and that is estradiol and progesterone. Progestin is fake, and there's so many different estrogens. So the book really will, explain, everything, hopefully with a lot more clarity. And as far as route, how you take it, you don't want to take any hormone by mouth. When you take something by mouth, the liver sees it before it is distributed in our bloodstream, and the liver reacts to something. It's an abnormal concentration that it sees. It's not dispersed in the blood yet, and it causes problems. For instance, estrogen by mouth will cause blood clots, a high risk of blood clots. We've known that rather from the 1960s. It's still done. It's wrong. You should never take estrogen by mouth. The problem with taking progesterone by mouth is that it converts to other hormones by the time it gets into the blood, and it's not consistent. So topical, for now, is the most consistent and safest way to take hormones. Injections, certainly not estrogen and progesterone. Progesterone would be too painful. It's very thick. It's oil-based. You have to do it every day, twice a day. And you don't want to be doing that. You can, but you don't want to. Again, you don't want to take estrogen either. It's very easy to absorb into the skin. But testosterone for men, injection is actually the best. It's the most effective. I've tried to do it topically, but it doesn't give the same effect. So for men, definitely injection. You don't have to do it every day. It's usually about 6 times a month. And for women, it's topical, and that seems to be what works the best. I've done this for over 20 years, and consistently we see the best results with this.
Now, you mentioned for men, obviously it's near and dear to my heart, is that 6 injections, is that self-administered? Is it coming into the clinic?
It's very easy. It's super easy. It sometimes surprises me. Actually, I enjoy when I explain to men that it's an injection, and they just don't like the thought. But when I actually demonstrate, they're surprised how easy it is. The very first couple of times you do it, if you've never injected, it does seem a little cumbersome and intimidating. But once you've done it a couple of times, it's nothing. It doesn't hurt because it's oil-based. And, men just get on with it. They're very good with their phone. They'll put in which days they need to do it, and it's not a problem.
So I want to put into the chat log here, if people want to reach Dr. Rashid, the Gmail is drselmarashid@gmail.com. Also, the office phone number I put in there is 331-777-2419. So you can reach out to her office if you want more information. And I imagine schedule a consultation of some kind, right? Dr. Rashid. Yeah.
Oh, yes, definitely.
Yeah. Okay.
Yes.
Terrific. In fact, I guess I would ask, like, what are the initial steps if someone wanted to treat with you directly or with your clinic? What are the steps they should take?
Well, first we screen them if they're the right candidate. Once they are, then I personally would like to spend about an hour with them understanding, just the history and what it means. And then, with me and my office staff, we just walk everybody through. It's a lot. It's actually a lot easier than it seems. Um, it just honestly, it's amazing the type of response we get. The interesting thing is that women come to me with menopause symptoms. And in my mind, I'm thinking that's easy and that's not even a big deal. The main thing is that what are these symptoms telling you? They're telling you you are on a path of rapid aging. You're going to get senile dementia. You're going to get osteoporosis. You're going to get muscle degeneration, weakness, bone degeneration. I mean, your joint degeneration. Immune system is going to suffer. Your cardiovascular system is going to, everything about you is going to go downhill. That is what I'm going to give you. Yes, of course, I'll take those symptoms away. That's the easy bit. But the most, the profound, gift of this treatment is how it keeps us at our best. And I would like to add that one of the most powerful things that hormones do for us is our brain function. And that's my favorite chapter in the book, that how these hormones profoundly maintain our mental capability, our memory, um, prevent dementia, etc. And so as you get older, your brain just gets better. You have an excellent, strong brain with a lifelong accumulating experiences. You can't get that any other way. And every year you become a better person, a better version of you, rather than degenerating.
Oh, I mean, that's incredible, and I appreciate the point. Is people are coming to you because they're thinking of the symptoms that they're experiencing, and they want you to take those away. And
Yeah,
those are the least important things.
absolutely.
Okay.
Yes.
Yeah,
Yeah.
that's pretty incredible when you can deliver so much more to them than the
Yeah.
thing that they're really coming to you to solve. Doctor, what is the geographical area that people where you can help people?
Well, it's wherever I have a medical license, and currently it's in California, Illinois, Colorado, and Nevada. We are trying to get licenses in other states only because we're having so much, request and interest. So hopefully, depending on, um, of course, it's a very expensive procedure to get licenses in every state. But if we have enough demand, we certainly will try to help people in other states too.
And how does that work, Dr. Rashid? If somebody, I know you have a clinic in the Reno area, correct?
Yeah, Reno and San Jose. I don't have a physical office in Colorado, but I do have a physical office in Chicago area, Lombard. But we do telemedicine. The interesting thing is that before COVID, I was trying to encourage people to see me through telemedicine. They always thought that they would get less of a service, but once COVID hit, the panic was the other way. That, oh my God, can we even get hormones? Can we even get our treatment? And since then, nobody likes to come in person. Everybody just prefers to just do everything through telemedicine. It's a lot more convenient. You save so much time in traffic, park, all of that. The whole nonsense about going to a doctor's office, and the timing is a lot more precise too. So no, it's a lot easier to do telemedicine.
Yeah, it's interesting how really those things that we were trying to do well
Yeah.
before, immediately we had to do well because of COVID, right? They leveraging technology more fully, and people now understand how they know what Zoom is and how to use Zoom or Google Meets or whatever it is
Yeah.
to do this. And I imagine they just connect through your Zoom or your website or whatever.
There's different ways we do it. Depends, on the patient's comfort level with technology. So no, we've not had any problems.
That's
But again, 100% of our patients prefer that. I won't say 100%. There's always one or two that want to come in, and we're more than happy to accommodate.
Well, does it typically involve an in-person evaluation to begin with, or do you do telemedicine and work out the details as
Well,
appropriate?
you don't need an inpatient at all. Interesting. I don't do a physical exam on anyone. It's all what you're telling me, and of course, if you have any labs or data. And then when it comes to showing your heart rate, we can again show you through media.
Uh, Honestly, that's excellent because, for instance, we're here in Central California, and we could make a trip to San Jose or up to Reno if we needed to. But it sounds like between local labs and remote communication with you in your office, that all those things can be taken care of.
Oh yeah, absolutely, absolutely. And my most resistant patients are just having a lot of fun, just doing telemedicine and then referring friends, and nobody's ever had a problem with this. Yeah.
That is excellent. Well, Dr. Rashid, your book is out. It is launching this week. We're excited to watch the progress of it. And before I let you go, is there any other thing that you would like to share with people? Because I know I've been peppering you with questions, and so many coming from the watchers of this, which is terrific. Is there anything else that you'd like to share?
Well, I would like to just emphasize that although my book does tell you how hormones are going to help you prevent the chronic diseases of aging, this topic has been controversial for about 22 years, actually 20 years. And so a lot of medical professionals will basically try to talk you out of this and say, oh, I don't like this, I don't believe in this, etc. So that's an that's one of the reasons I like the Kindle version. So you have the information at hand. Every study that is pertinent that has been done to date is in that book, and all the references are there. The actual risk of estrogen to breast cancer, which is a myth, there's nothing in the literature that is very clearly explained in my book. So if you have the Kindle version, it'll be very easy for you to just hold that up and show them that this is what I have. Where are you coming from? Because it's very sad to be deprived of this therapy and quality of life through our later decades when it matters the most, just through misinformation and misinformed healthcare professionals. That's the main reason I wrote this book, so that we can have the truth in front of us, all the studies, all the facts, data, everything explained, so that we can, give us, have a chance at living the rest of our lives in the best possible way.
You mentioned something toward the beginning of the interview where you just said, we, and by we, I think you meant medical professionals, are just not trained in certain aspects.
Yes.
And I think that's important for people to understand, is that it isn't that their doctor, let's say their doctor says, oh no, I don't believe in that or whatever. It's not necessarily that your doctor is bad or anything like that. It's that your doctor just may not have received this type of training, and certainly probably hasn't specialized in it for decades like Dr. Rashid has. And so I think this is where we as patients, being our own advocates, which is super, super critical, can take the steps to educate ourselves, and connect with professionals who really specialize in these things, instead of only a doctor who has to cover such a wide breadth of different coverage areas and treatment areas. It's like, I had to have spine surgery. Well, I wouldn't want to have my general practitioner be telling me what spine surgery would be appropriate. I need to be with a spine surgeon, someone who specializes in spines. And I wouldn't even just want a general orthopedic surgeon. I would want someone who specializes in spines, because their expertise in hips and feet isn't nearly as important to me. And so I think of the same thing when it comes to treatment like this, is working with a professional who understands and specializes in this. Anything I say there that was wrong, doctor?
Not absolutely not, but hormone replacement therapy has a unique sort of situation in medicine where, due to very unfortunate reasons, it became controversial. And there's a chapter in my book on the controversies, and it explains that it explains everything chronologically from the 1930s to now, what's been happening that has maligned this field and have had so many had so much bad information out there that has frightened doctors to even talk about it or deal with it. So it's unfortunately got an added nuisance associated. But I explain all that. That will hopefully will empower my patients and people to at least understand the truth, so that when they're given the wrong information, they can explain it and clarify it with the healthcare providers. And it's not fair for a healthcare provider, and they're doing it all the time, by the way, to say this is wrong, hormone replacement is wrong, without knowing where are they getting the information from.
Yeah, and so many of us do this, just like and doctors as well. They get some anecdotal piece of information and just kind of latch on,
Yeah.
right? Instead of being able to go back to the studies and look at them. Doctor, thank you so much for your time. We've gone longer than we normally do, but that's because we had so many great questions, and this is so great information that you're sharing with us. Congratulations again on your book launch, and we'll be excited to see how that proceeds in the time ahead of us. I just want to thank you for entrusting us at Ignite Press to get your book out to the world. It's been exciting to see it come to shape, and now it's out there, so even better. So thank you so much, Doctor.
Thank you so much, Everett. It's been wonderful talking with you.
All right, so pick up your copy today of The Truth Behind Hormone Replacement Therapy. The paperback and Kindle are on Amazon. The Kindle is on a special launch pricing of 99 cents. And I would encourage you to get that, especially like Dr. Rashid said, then you always have it with you. It's in your phone, it's in your iPad, it's your computer. And in fact, by the way, in case you don't know this, if you don't normally read Kindle, there is a Kindle reader already installed on the device that you have, more than likely. And there are apps available for phones, tablets, laptops, desktops, all of that. So definitely pick that up. So thank you again for joining us here for this book launch. And if you want to get your book out to the world, if you would like to be on a live cast like this and we be interviewing you about your book, please reach out. You can schedule a time with me at ignitepress.us. That's ignitepress.us, where you can set up a book consultation and we can talk about your plans for your book. Thank you again for joining us. Take care and God bless.